All right, so you may recognize some of these faces. These are the folks that have been working with the simulation team from Oregon Health and Science University. Dr. Gold, Dr. Rivera-Tuch, Dr. Nonis, Jessica, who will be Dr. Jessica very soon, myself, and Emma Vick. These are the directors of our OHSU simulation. We have a new medical director, Dr. Renee DeVersdal, as well as Elena Ahn, who is the director of our virtual surgical simulation center, and Jessica, who is the director of the Mark Richardson Interprofessional Simulation Center. Yesterday, I think Jessica mentioned that we started out very small. We had a very small team at OHSU. When I first started working with Jessica full-time in simulation, I was the only simulation tech, and then we had a simulation coordinator for the skills lab. And now, all of these people do simulation operations on the 4th floor of the simulation location that Jessica is the director for. Whoops, there we go. These are the members of our Standardized Patient and CETA program. We have a handful of different trainers for our standardized and simulated participants, as well as Emma, who leads the Standardized Patient program, and our colleague Alyssa, who leads the Sensitive Exam Teaching Associate program. These are the members of our virtual surgical simulation team and our Multnomah Pavilion simulation team. And these are some of the programs that Jessica will talk to you about.
So at OHSU, we have, similar to BDMS, we have simulation throughout our whole system. So we have hospital nursing, School of Nursing, School of Medicine, College of Pharmacy, Department of Anesthesia, Department of Surgery, OBGYN, the Simulated Code Interdisciplinary Team Training, Neonatology Program, School of Dentistry, the Physician Assistant Program, and Department of Emergency Medicine, and also other hospital teams. It's happening with the work that Dr. Nonis is doing and Dr. Rivera-Tuch is doing. So we are very busy. With all of these programs, there are faculty embedded within these teams. And we are also looking at sustainability. How do we train our faculty who are leaders and have full-time, multiple hats, multiple jobs? So we are also looking at that. This is the evolution of simulation at OHSU. Lish mentioned that early, there were 2 people on our team. We started very small, 20 years ago. We were the first simulation center in the state of Oregon at Oregon Health and Science University. And in 2005, we had simulation clinical learning centers created in Ashland and in Klamath Falls through the schools of nursing, who also partner with their local hospitals. In 2006, La Grande, another part of the state, created their simulation clinical learning center. And in 2007 is when our OHSU Simulation and Surgical Training Center came online, along with the School of Medicine Clinical Assessment Center, which is now morphed into our operations with our SP program and the 20 outpatient clinical exam rooms that Emma will talk more about in a little bit. In 2008, another simulation center opened in Monmouth, Oregon. And then 2013 is when the Mark Richardson Interprofessional Simulation Center was established through state bonds and a partnership with Oregon State University and Portland State University. And then in 2020, we also acquired some old operating rooms, and which became our Multnomah Pavilion simulation training space. So we have additional 9,000 to 10,000 square feet of simulation training which has been great for just-in-time training and the expansion that you will hear from our colleagues later as well. In 2020, in Klamath Falls, a new simulation center came online. It's the Collaborative Health Center, and that's in Klamath Falls, and a partnership with the Sky Lakes Hospital system. That's the evolution, and here we are today. Who are our learners at OHSU? You already know about this, but just briefly. Undergraduate nursing, graduate nursing, medical, undergraduate medical education, graduate medical education with our residents and fellows, physician assistants, radiology, dentistry, pharmacy, hospital teams, hospital nursing, and other disciplines that do their own distinct clinical skills training across the enterprise.
This is the layout of the third floor of the Mark Richardson Interprofessional Simulation Center. We have 20 standardized patient rooms, an 8-bed clinical skills training room, medical supply room, debrief room, reception and lobby, and support and prep offices. On the fourth floor, we have 7 flexible simulation theaters, 2 classrooms, 5 debrief rooms, 5 control rooms, a skills lab, our reception and lobby, support and prep office space, and biomedical support where we fix all of our task trainers and simulators when they are broken and they need some repair. Yes. We have all sorts of different modalities that we use for training at OHSU Simulation. One of them, which is the one that I primarily focus on, is mannequin-based simulation in high-fidelity theaters. This is an example of one of our theaters and one of our mannequins. Over on the far side there is one of our newest simulators. It is the SimMan 3G Plus. We also offer skills and task training in a lot of our different locations. This one is the Mark Richardson Interprofessional Simulation Center.
Thank you. I also wanted to talk briefly about our SP and CETA program. And so this is a little bit of an older picture. This is pre-COVID, and our numbers dwindled, and now they're expanding because we're doing a lot of new work. But our SP program is around our patient actors who come in and portray different types of patients, but also family members, and we have embedded participants as well. And we end up with about 60 of our SPs currently. And then we also have the CETA program, which is our sensitive exam training associates, which teach all kinds of the kind of invasive procedures and examinations that they teach on their bodies. And it's a very powerful framework for our patients having agency and our learners becoming really comfortable with uncomfortable exams. Next slide. Insitu.
We also offer Insitu simulations. This is my colleague, Nicole Callison, and Nicole has been expanding our Insitu simulation program, which kind of dwindled off during the pandemic because we were not allowed to have our teams go up into the hospital patient care areas. We are currently doing Insitu simulations in the operating rooms, PACUs, ICUs, EDs. We work with medical residents, neonatology, dental residents. We do OB simulations and also work at the Veterans Hospital. These are some photos of our Multnomah Pavilion space. This is one of the newest locations in Portland. As Jessica mentioned earlier, we took over some of our old operating room suites. There are 7 OR suites and also a post-anesthesia care unit area that we have turned into a skills lab. And there are 10 different bays there that we can work with either standardized patients doing POCUS, point-of-care ultrasound exams or physical exams. Emma is up there a lot with a lot of our SP models. They also have the operating room suites that are set up as skills lab spaces, and they do both wet and dry skills labs.
So Virtuoso is the Simulation and Surgical Training Center. Many of you have visited that space, and for those of you who have not, we invite you to come one day. We do the human tissue, animal labs. We have flexible suites. So there are 10 different bays, operating room bays, that are used for all sorts of innovative training with orthopedic residency and OBGYN residency. All of the anatomy courses take place here. And this is some of our data. Yesterday you shared some data and we said, let's put a little data in. We know you want to see this. So this is our event details. So number of events in the last 2022 to 23 was 1,952 events overall. And this is divided here by some of the different groups and sponsors that we work with. This is by term and our hours. So the same data previously, and here you can see we have close to 10,000 hours. Our learner count for 2022 to 2023 was 46,191 learners. And then this is by our scheduling teams or modalities. So we also are able to look at the data from different lenses, by locations, by our partner sponsor groups, or by just overall numbers. So here, again, we have 46,000 learner count for the last year. So we have been busy, I think. We do have a lot of groups that we've worked with collaboratively and for presentations. I mentioned earlier, obviously with our International Health Alliance, we've done multiple presentations. Dr. Dean was at an IMSH one year and was part of a panel with Lish, and that's been an amazing journey. So I will just end with one of our very first groups that came to Portland. Some faces are familiar, and so long ago, we were so young. I think this is from 2016, so we have many more pictures, and we appreciate your time and attention this morning and look forward to a very productive few days. We're here to partner and answer any questions that you have. Thank you.